Hello everyone. In this video we will discuss about the topic of physiology, which is BP, blood pressure. So what is BP? BP is basically the lateral pressure exerted by the moving column of blood on the walls of arteries. It is termed as BP. In normal adult have 120 by 80 mm of Hg is normal BP. Systolic and diastolic, these are the two types of BP. Systolic is 90 to 140 mm of Hg is normal, and diastolic is 60 to 90 mm of Hg is normal BP in adult. Now let us see what is systolic BP. Systolic BP means maximum pressure exerted on the walls of arteries by flowing blood during systole. It is called as systolic BP. Its normal value is 120 to plus minus 20 mm of Hg. Now diastolic BP. Diastolic BP is the minimum pressure exerted on the walls of arteries. It is called as diastolic BP. It ranges from 60 to 90 mm Hg. This range is normal. There are three types of BP. First, casual BP, second, basal BP, and third, mean arterial BP. First, casual BP. Casual BP means BP is recorded of a subject when he walks into a clinic. Basal BP is recorded of a subject under a basal condition in supine position or after a brief rest under the fasting state in the basal BP. Mean arterial BP means the average pressure recorded during the cardiac cycle. It is called as mean arterial BP. The normal value is 95 mm of Hg in mean arterial BP. BP is recorded by three methods. First, direct method, second, indirect method, and third is palpatory method. Now, let us see the disorders of BP. First, hypertension means increased BP, and second is hypotension means decreased BP. Hypertension means increased BP have two subtypes, primary hypertension and secondary hypertension. Whereas in hypotension there are four types. First, primary hypotension, secondary hypotension, postural hypotension, and acute hypotension. Now let us see hypertension. Hypertension means increase in either systolic or diastolic. Both conditions are called as systemic or simple hypertension. It is hypertension have two types, primary and secondary. Primary hypertension contributes 60%. In primary hypertension is caused by when the parent hypertensive is 50%, thus child develop hypertension. Primary hypertension cause not known. It is due to heredity. It contributes 60%. Now, secondary hypertension. In secondary hypertension, disease affecting other organs. So, what is the management of hypertension? Diet restriction, fat-free diet to low cholesterol level, reduce sodium intake, avoid smoking and alcohols, etc. Hypotension. Hypotension means BP less than normal or systolic less than 90 mm Hg and diastolic less than 60 mm Hg is termed as hypotension. There are two types, primary hypotension and secondary hypotension. Primary hypotension cause is not known, cause is unknown, and in secondary hypotension they have hemorrhage, myocardial infarction and heart failure like symptoms is seen. In postural hypotension, sudden fall in BP, standing below critical level, not correct by neural mechanism. It includes severe diabetes, drug toxicity, etc. In acute hypotension, sudden fall in BP, acute hemorrhagic condition is seen, diarrhea is seen, severe vomiting, acute myocardial infarction like symptoms are seen. So this was all about the physiology of BP and disorders of BP. Thank you.